Okay, so first we'll talk about anatomy of nose and paranasal sinuses. Okay, and then we'll talk about physiology. So we do not study nose and paranasal sinuses differently. Okay, they are all studied in together. So first, let us talk about the external nose. External nose is pyramidal in shape, and the root. This is the root. Okay, this lies up, and the base is directed downwards. Okay, and here we have the diagrams from the front view and the lateral view. Okay, so this depressed part is the root of the nose, and the nostrils are also called the nares, and between the two nares there is columella, and this is the nasolabial angle, and this part, the prominent part, okay, is the dorsum. Okay, and this part is called the alar groove. Okay, and this is the philtrum, the part between the moustaches, okay, just below the columella. Okay, this similar sort of diagram where I have focused on the nasal tip. Okay, all of this is lobule, the lobule of the nose, and this is the tip, and this is the supratip area, and this is the columella. Okay, and this part is the Nasian. Okay, the glavula is somewhere here between the eyebrows, and here we have the Nasian, and as in the last diagram, this is the dorsum. Okay, and these are the nasal ala, and the nasal ala, they make the alar groove here. Okay, and the nasolabial fold and the nasolabial angle. Now the nose is an osteocartilaginous framework. The upper 1/3 is bony part, and the lower 2/3 are cartilaginous part. So if you palpate your nose, you can feel that. So this part, the upper part is bony, okay, and then lower part is the cartilaginous part. All right. So in the cartilaginous part, there are 4 cartilages: the upper lateral cartilage, the lower lateral cartilage. So lower lateral cartilage are also called as alar cartilage, and then there is lesser alar cartilage, which is also called sesamoid cartilage, and the septal cartilage. Okay, this cartilaginous part is important for you, and you need to remember all these names. So in the diagram, I'll show you where these cartilages lie. Okay, this is the bony part, the 1/3, upper 1/3, and the lower 1/3. This is the cartilaginous part. All right, here the bony part and the cartilaginous part. So this is the nasal bone, and here just below that there is upper lateral cartilage. Okay, and this is the lower lateral cartilage, and here this is the sesamoid cartilage, a very small cartilage, or this is also known as lesser alar cartilage. Okay, and the lower lateral cartilage or the alar cartilage has 2 cross, okay, that we can see here. Okay, lateral cross, this is the lateral cross here, and the medial cross. Okay, so the medial cross from the 2 sides, they form the columella. Okay, and inside the columella there is the nasal septum. Now you can see here similar sort of diagrams. Okay, the nasal bone, and this is the maxilla, the frontal process of maxilla, and the nasal bone is attached here. Okay, and the upper lateral cartilage, and this is the alar cartilage. Okay, in the lateral view and the frontal view. Okay, here these are the diagrams that show you some sort of nasal deformities. Okay, so the normal nose appears something like this. Okay, but most of us, they have some sort of deviation. Okay, this is saddle nose, and here you can see the supratip is depressed, so supratip depression, and this is a hum nose. Similarly, there is crooked nose, okay, and the deviated nose. All right, so we are going to talk more about this in the class for nasal septum. Now we just finished the external nose, and now we are going to talk about internal nose. Okay? So the internal nose has 2 openings. Okay, the anterior opening and the posterior opening. You can see the anterior opening, but you cannot see the posterior opening. Okay, these are also called as choana. And similarly, there is the vestibule of the nose. Okay, the innermost part is the vestibule, which has skin, and it is lined by hair. And then there is the nasal cavity proper. The nasal cavity proper has lateral wall, medial wall, roof, and floor. Oh no. डाक्टर उसमा छ है क्लासमा फलो गर्छ है त ल ल ल okay and this is a cadaveric image. Okay, here you can see the nasal septum. Okay, and this is the septal cartilage that we just talked about. Okay, this is the perpendicular plate of ethmoid and this is the vomer. All of these make the nasal septum. Okay, and in this diagram the nasal septum has been removed, and here you can see the vestibule, okay, the anteriors, and this is the nasal cavity proper. Okay, this is the lateral wall. Okay, and this is the medial wall. Okay, and when you take out the septum take out the septum, you can see the turbinates and the meatus, and this is sphenoid sinus. Okay, and the frontal sinuses. All right, and this is the nasopharynx area. Okay, if required then we'll come back again to this diagram. Now see here. Okay, this is what we talked about. This is the septal cartilage, the perpendicular plate of ethmoid, and the vomer bone. Okay, this forms the nasal septum. Now here, these are the major parts. Okay, but apart from this there are minor contributions from many different parts. Okay, so I have also labeled the diagram. This one is septal cartilage. Okay, ethmoid plate. Okay, this is the vomer, and here this is the palatine crest, this is the maxillary crest, and this is the vomeronasal cartilage, and similarly this is the medial alar crus, and this is the upper lateral cartilage. Okay, this is the nasal bone crust, and this is the frontal spine, sphenoid rostrum. Okay, and here this is the membranous septum. Okay, in the exams you may be asked, the questions may be like this. Okay, what are the major contributions and minor contributions for nasal septums? So these three parts, they are the major contributors, and this rostrum of the sphenoid, the palatine crest, maxillary crest, frontal process. Okay, they are the minor contributions. Okay, we'll again talk about this in the chapter for nasal septum, but because we are dealing with the nose as a whole, the anatomy of the nose, we need to know this even today. Okay, the septum has been removed, and this is what we get. Okay, this is the vestibule. Okay, this is the turbinate. Okay, there are 3 turbinates, or sometimes there can even be 4 turbinates. Okay, so this is the inferior turbinate, and the area, the cavity below the inferior turbinate is the meatus, the middle turbinate, and between the inferior turbinate and middle turbinate there is middle meatus. Okay, and similarly the superior turbinate. Okay, okay, we'll talk later about the agarnase and atrium. Now this is the coronal section. Okay, here you can see the maxillary sinuses, this is the nasal septum, this is the inferior turbinate. Okay, this is the middle turbinate and the superior turbinate. Okay, and these are the orbits. Okay, here this is a diagram of this is the skull, and in the skull all the muscles and all the fatty tissues, nerves, blood vessels, they have been taken out, and this shows only the bone. Okay, here you can see the orbit. Okay, this is the orbit, and here you can see the septum. Okay, and this part is called the pyriform aperture. Okay, so I put on this diagram so as to tell you, so as to make you know about the pyriform aperture. Okay, so the pyriform aperture is an important landmark. Okay, for example, we also deal with pyriform aperture in epistaxis, which also means nasal bleeding. Okay, sometimes this is a landmark to differentiate between anterior and posterior nasal bleeding. Okay, but because we are not talking about epistaxis, so we'll skip this for now. Okay, here in the sagittal section, the turbinates, they have been removed to show you the meatus. Okay, inferior meatus, middle meatus, and superior meatus. All right. Now the lateral nasal wall. There are 3 to 4 bony, somebody say it concha, somebody also pronounce it conchi. Okay, covered with mucosa to form turbinates. The space below and lateral to turbinate is called meatus. Middle meatus contains a round bulla ethmoidalis separated from uncinate process by hiatus similaris that leads to a funnel shaped ethmoidal infundibulum. Okay, so just know the names: bulla ethmoidalis, uncinate process, and hiatus similaris. Okay, now inferior meatus. So inferior meatus, it is the largest meatus. and it extends the entire length of the nasal cavity, that is from the anterior opening to the posterior opening. Okay, and this one is a very important point. Okay, so the nasolacrimal duct opens here. Okay, after MBBS, when you're appearing in like license exams, this question is usually asked. Okay, what is that one? What opens in the inferior meatus? Okay, and the options may be the lacrimal duct, okay, the maxillary sinus, the frontal sinus, and things like that. And the answer is nasolacrimal duct. Nothing other than nasolacrimal duct opens here. So this is covered by Hasner's valve, which is not a true valve but a small folds of mucosa. Okay, so the Hasner's valve. Inferior turbinate, it is a separate bone. Okay, unlike middle turbinate and superior turbinate, which are the parts of its model bone. Okay, this is a separate bone, and it is covered by respiratory epithelium with a high number of goblet cells. Middle meatus. So it receives drainage from the frontal, maxillary, and interethmoidal sinuses. Okay. Maxillary hiatus. It is a large opening on the medial wall of the maxillary sinus covered by membranous area, which are covered by fontanelles. Accessory ostia found in 4 to 5% in these fontanelles. Okay. Okay, here. So this is the lateral wall. Okay. And here these are the openings. Okay, this is the maxillary ostium, and this is the axillary ostium. Ethmoidal bulla. Okay, this is one of the most condensed feature of the middle meatus. It contains the largest interior ethmoidal air cell. Okay, the ethmoidal air cells are divided into anterior and posterior. So this contains the largest ethmoidal cell. Okay, so we are not going to go into more detail. Agar nasi. Okay, so this is the interiormost part of the ethmoid. Hiatus seminaris. It lies between the posterior margin of the oscillate process and the interior surface of the ethmoidal bulla. Now here you can see the ethmoidal bone. Okay, so ethmoidal bone has different parts. Okay, the crista galli, the perpendicular plate, and this is the middle turbinate, and these are the labyrinth or the ethmoidal air cells. Now meatal drainage. Okay, so this is also very important. In the inferior meatus, the nasolacrimal duct drains. In the middle meatus, frontal, interethmoid, and maxillary sinuses drain. So the maxillary sinus drains through the nasal ostium and the accessory ostium. And in the superior meatus, there drains the posterior ethmoid. And similarly, there is sphenoethmoidal recess where the sphenoid sinus drains. Okay. So we are going to talk more about the drainage in the physiology chapter. Okay. Okay. There is a lot of information on this in this slide, but this one particular slide sums so much of the information that we saw in the previous slides. Okay. So let us take some time and go into detail. Okay. This is the inferior meatus. This is inferior meatus. Okay. Here we have the opening of the nasolacrimal duct and nothing else. Okay. And this is the inferior turbinate. And here between the middle turbinate and the inferior turbinate, there is middle meatus. And this is very important because there are so many openings. And as you can see here, there is the opening of the maxillary sinus, and here the opening of the middle ethmoidal air sinuses. Okay, and then there is the bulla ethmoidalis, there is hiatus seminaris, and this boomerang shape. This is the oscillate process, and even the frontal sinuses, the open here. Okay, so this is a very important landmark even in nasal surgery. So this part, this is also called as osteomeatal complex. Okay, so whenever we need to operate on nasal patients, this area needs to be dealt with meticulously. Okay, and now here we have the superior meatus where you can see the openings of the posterior ethmoidal air cells, and then superior turbinate. All right. Now here, this may be confusing or complicated for you, but it's not like that. Okay. So this is inferior terminate, and here this is the nasolacrimal duct. It opens in the inferior meatus. This is the similar sort of diagram in 3D. Okay, and here you can see the uncinate process, ethmoidal bulla. Okay, this is superior terminate, middle terminate, and middle meatus. Okay, and the frontal sinuses, they drain here. Okay, and similarly the anterior ethmoidal cells. All right, and here you can see this is the posterior cells. This drains into the sphenoethmoidal recess, and here this is ethmoidal sinus drains into the superior meatus. Okay, and this sinus is here, frontal sinus is here. So class, so do you think it is very complicated for you? If you have anything to tell, then you can just send a message. Okay. Okay. So this particular area, this is the coronal section. Okay, and this is what I talked about a few minutes ago. This is the osteomeatal complex, and this one particular area is the most important part in nasal surgery. Okay, just give me a minute. Hello. नमस्कार म कल गर्छु है त क्लासमा छु अहिले एकछिन है okay, so this is the middle meatus. So you can see some structures here. This is the inferior terminate here. Okay, and this is the middle terminate, and this is the sinus opening. Okay, and there are many other structures like consonant process, hiatus similaris, ethmoidal bulla. Okay, so what is osteomeatal complex? Okay, okay, so this is important, and it is good to know the definition. Okay, so it is complex microarchitectural pathway in ethmoid labyrinth that drains interior group of paranasal sinuses. Okay, so in the interior group of paranasal sinuses, you get frontal sinus, maxillary sinus, and anterior ethmoid air cells. Okay, so it consists of frontal recess, ethmoid infundibulum, hiatus semilaris, uncinate process, bulla ethmoidalis, and middle meatus. Okay, osteomeatal complex pathology leads to infection of all anterior paranasal sinuses. So what you can see here, most of the infections of the nose is due to the poor ventilation. Suppose, okay, so here you can see a big opening. Okay, so all the fluid secretion, they have been training here in the nasal cavities. Suppose there is infection, or there is mucosal edema, okay, or there is some mass here. So due to that, if the osteomeatal complex, if it gets blocked, then these secretions, and these secretions, they do not get discharged, they do not get drained. And if there is no drainage, there will be stasis, and the stasis will lead to infection. Okay. Now variants of osteomeatal complex. Okay, so we are going to skip this because this may not be very important for you, but it is good to know. Okay, so okay, I'll tell you this. This is concha bullosa. Okay, so here this is the middle terminate, and this is the middle terminate. Okay, so here the middle terminate is pneumatized, and this pneumatized middle terminate is called concha bullosa. Okay, this can be seen on X-ray too, but very difficult. Okay, but this is a CT scan image. So here you can see that. Okay, these stars, these asterisks, they are the pathology. Okay, and because of the blockage of the pathway, okay, there is the stasis of the secretion. So you can see here on this side, on the left side, okay, it is clear. Okay, the ear, we have ear, the ear appears black on radiograph, but here there are some secretions. Okay, and here there are secretions. So this person is suffering from, okay, right-sided sinusitis. Okay, maxillary sinusitis, small sinusitis, and we do not see the frontal sinuses here in this film. So it may be pansinusitis because most of the sinuses, they are involved. Okay, this is what concha bullosa appears on nasal endoscopy. Okay, this is the CT scan radiograph. Okay, the radiographical image, and this is endoscopic image. Okay, now this is the middle terminate. Look here, the shape of the middle terminate here and the here. Okay, so we are going to give a lot of time here. Okay, and this is endoscopic image of the paradoxally curved middle terminate. And here you can see the bulla ethmoidalis. There are two layers. Okay, let us leave this. Okay, so there are different sort of air cells. Okay, now you need to know ethmoidal air cells, but air cells, they appear in relation to the orbit, they appear in relation to sphenoid. So only the cells are the air cells that appear in relation to the sphenoid sinuses. Okay, this diagram is important for you. This CT scan. Okay, look here. The mucous of the middle terminals, they are thickened, they are edematous, and because of that, there is the blockage of the drainage, and hence there is the stasis of the secretion. Here you can see the air, but this fluid part, it may be secretion or like any other thing or any sort of secretion. So it has gravitated towards the bottom, okay, and here, okay, and here in the ethmoidal sinuses, okay, and everywhere there is secretion, okay, and thickening of the mucosa. So this is the mucosal disease. Now blood supply. Okay, blood supply of the nose is very important because epistaxis is a very common condition. And in our OPD and emergency in 24 hours, we see around 5 to 6 cases every day. Okay, so epistaxis is very common. Okay, so the blood supply is by sternopalatal artery, greater palatal artery, superior level artery, anterethmoidal artery, and posterior ethmoidal artery. Okay. So all these arteries, they supply the nasal septum and the lateral wall. Okay, the middle wall and the lateral wall. Okay. And these four arteries, they together they form the Kisselbach's plexus, okay, or the Little's area on the interior part of the nasal septum. And this particular area is, the commonest site for nasal bleeding or epistaxis. Now this diagram will come again in the epistaxis chapter, okay? So here you can see the ophthalmic artery is divided into anterior ethmoidal artery and posterior ethmoidal artery, and the blood vessels, they come here, and from maxillary artery there is sternopalatal artery and greater palatal artery, and these are coming like this, and from the facial artery there is superior level artery, and here they form the Little's area. And as you can see here, and this is also a very important MCQ question, which is usually asked in your PG exams, okay, when you're appearing for entrance exam for PG or even in licensing exams, okay, which one among the four arteries do not contribute to Little's area? Okay, so look here, the terminal branches of the superior level artery, they come here to the Little's area, and the greater palatal artery also reaches here, okay, and the superior palatal artery also reaches here to the Little's area, and the anterior ethmoidal artery, the posterior ethmoidal artery, doesn't reach up to the Little's area. So this is excluded, okay, and so this is the answer. Which one is not there in Little's area? So posterior ethmoidal artery isn't there. In this little area, the blood supply is from both the external carotid artery and the internal carotid artery. Okay. So look here. Okay, this is the same diagram. So these are the areas covered by the anterior ethmoidal artery, posterior ethmoidal artery, this is sternopalatal artery, superior level artery, and greater palatal artery. Okay, so sternopalatal artery is the most important artery because it is the largest contributor. Now venous drainage, okay, this is not very important, but yet you need to know ethmoidal veins, they drain through the ophthalmic veins and cavernous sinus. Okay, no, this is also very important because of, okay, the ethmoidal veins, they drain up to the cavernous sinus. Why? Because this is important because the infections from the nose, especially the furuncle and other things, okay, they can result into cavernous sinus thrombophlebitis. And cavernous sinus thrombophlebitis is important because it has a mortality rate as high as 40%. Okay. And similarly, Woodruff's venous plexus, it is present on the lateral wall near the posterior end of the middle turbinate. Okay, and this area is implicated in posterior nasal bleeding. Now the lining epithelium. So the skin is present over the nasal vestibule, and the olfactory epithelium is present over the upper 1/3 of the nasal cavity above the superior turbinate. And similarly, the respiratory epithelium is present over the rest of the nasal cavity and the paranasal sinuses. Okay, here olfactory epithelium, respiratory epithelium, and this is the skin. Okay, lymphatic drainage. Okay, so we are going to skip this. Now let us come to the paranasal sinuses. Paranasal sinuses, it is very important. Okay, So there are two groups, okay, anterior group and the posterior group, okay. So the anterior group comprises of the frontal sinus, interethmoidal sinus, and the maxillary sinus, and the posterior group has the posterior ethmoidal sinus and the sphenoid sinus. Right. So look here. So these are the maxillary sinuses, okay, in the lateral section here, and you cannot see sphenoid sinus here, but you can see it here with more sphenoid sinus. And here we have the ethmoidal ear cells and the frontal ear cells. This is the anterior view and this is the lateral view, and this is the eye socket, so the orbit, okay. So the sinuses, as you can see here and here, they lie above, below, and behind the orbit, okay. Above frontal sinuses, below maxillary sinus, and behind ethmoidal ear cells and sphenoid sinus, okay, above and below. Okay, this is how the sinuses it fits in the face, okay. Maxillary sinus, ethmoidal, sphenoid, and frontal sinus. Okay. Okay, the frontal sinus, superior turbinate, superior meatus. Okay, this is the nasal septum. Okay, middle meatus. Okay, maxillary sinus and inferior turbinate. Okay, these are how the paranasal sinuses are present. Okay. Now you can also be asked questions from this slide. Okay, and you need to recite it. You need to learn it, and occasionally there are questions from this slide. Okay. So development of paranasal sinuses. Okay, there are four sinuses that we are going to talk about: maxillary, ethmoidal, sphenoid, and frontal. Okay, so maxillary and ethmoid, they are presented at birth. Okay, but sphenoid sinuses, it presents at only 2 years of age, and frontal only by 4 years. Okay, even though these two are present at birth, and if you see for X-ray, these are not seen. Okay, let me update. Okay, these are not seen before the 4th month, and small sinuses, they are not seen before the 1st year. And similarly, sphenoid sinus is seen only after the 4th year of life, and frontal sinus is after the 6th year of life. Okay, so if you send an X-ray for of a 5-year-old child or 4-year-old child, and use this, you do not see that there is frontal sinuses, then you don't need to get worried. Okay, because like it won't appear in X-ray until the age of 6 years. Okay. Similarly, maxillary sinus reaches the adult size by the 15 years of age, ethmoidal sinus by 12, sphenoid by 18, and frontal by 15 years of age. Now the relations of the sphenoid sinus. Okay, this is important because there are so many important structures around. Okay, this is the sphenoid sinus, and here you can see the optic nerve, ventral carotid artery, maxillary nerve, and median nerve. Okay, here. Okay, this is the optic nerve, and the internal carotid artery is here, and this is the sphenoid sinus. All right, and these are the canal of 3rd, 4th, 6th, and this is the trigeminal first and second. Okay, and here you can see the pituitary gland. This is sphenoid sinus, and this is the cavernous sinus. Okay, so this cavernous sinus, okay, the venous drainage from the nose, it comes up to here, okay, through the ophthalmic veins. And this is, as I told you, this is very important because, okay, the infection from the nose, like small pimples or small swellings, they may lead to cavernous sinus thrombophlebitis, and if that happens, the patient may die. Okay, and this condition needs to be treated very aggressively. Okay, so what are the functions of the nose? Okay, so the nose, the functions are respiration, air conditioning of the inspired air, protection of lower airway, ventilation and drainage of PNS, olfaction, okay, nasal resistance, vocal resonance, and nasal reflexes. Okay, so it is not only breathing. Okay, when we ask what is the function of the nose, we say breathing, but that is not all. Okay, so breathing is respiration. Okay, that is one of the several functions. Okay, air conditioning of the inspired air. Okay, we'll talk about this. So whether you live in Manang or Mustang, or you live in Chitwan, okay, the air, okay, the temperature of the air that goes inside is roughly in the same range. Okay, so because the air is conditions, okay, the temperature regulated by the nose and the paranasal sinuses. Similarly, the protection of the airway we have here, we've reached in the nose that filters the larger particles, and similarly there are cilia, and ventilation and drainage of PNS. Olfaction, okay, this is a very important function. Olfaction, okay, we smell through the nose, okay, and the nasal resistance, okay, this is important. Vocal resonance, okay, okay, just try to recall when you are suffering from common cold, or like you have rhinosinusitis, and the intensity of your voice or the quality of your voice, it changes, okay, because it changes because the paranasal sinuses and the nose, there is edema, and there is no vocal resonance during the times of infection. Similarly, nasal reflexes, something like sneezing. Okay, air conditioning of inspired air. Okay, okay, so these were the functions of the nose and now the paranasal sinus. So they are mostly the same. Okay, they work together. Okay, so because the this air field, so this also lightens the weight of the skull. Now respiration. So respiration has inspiration and expiration. So air current passes along the mid portion of the nasal cavity in lamellar flow. Expiration, resistance of nasal valve and terminus lead to formation of eddy current in expired air. Okay, look here. This is what happens during inspiration. Okay, there is a lamellar flow. But during expiration, the terminates and all these things, because of this, okay, the air is recirculated. So that is how air conditioning occurs. So filtration. Particles less than 3 micrometer in inspired air are trapped by nasal vibrissae. Okay, the small hair in the nose, they are the vibrissae. Okay, so the particles larger than, okay, 3 micrometer, they are in the, if the particles are larger than this size, they are trapped by nasal vibrissae. Okay, so they are very important for function. Okay, so you do not have to trim. Like these are many people, they are trimming this nasal vibrissae, but nasal vibrissae are there for some reason. Okay, so do not trim them. Okay, they serve as a great purpose. Okay, similar to temperature control. Okay, nasal heat exchange between blood in cavernous venous sinusoids of terminates and inspired air by radiation and humidification, because they are secretions of nasal cavity. The secretions, they humidify the inspired air. Protection of the lower airway. So mucociliary blanket. It traps pathogens in inspired air that are larger than 0.5 micrometer and transports them for nasopharynx for swallowing. Okay, so the nasal vibrissae was the first line of the protection, and the smaller particles than than 3 micrometer, okay, they go inside, but it doesn't mean that they'll go directly to the alveoli or the lungs. Okay, then there is the nasociliary blanket, which will trap particles which are larger than 0.5 micrometer. Anything is smaller than this, like viruses, they can reach directly to the lungs and cause or prolongs sneezing. Okay, so sneezing is also protective mechanism. It protects against irritants. And similarly, there are lysozymes which kill bacteria and viruses, and there are immunoglobulins N, so which kill bacteria. Okay, and there are interferons. Now, mucociliary blanket. Okay, the mucociliary blanket, it has two layers. Okay, the superficial layer, the gel layer, and the deep serous layer, which is also called the soul layer. So the covered cells in nasal mucosa secrete a mucous blanket which move backwards like a conveyor belt into the nasal pharynx. Also, you must be knowing the conveyor belt. Okay, so the conveyor belt is nothing but it is like what you see in the factories. Okay, like something is produced. Okay, for example, the Coca-Cola factory. Okay, the bottles, they are kept in one part. Okay, and through the conveyor belt it moves somewhere, and then the drink is filled up there, and then and the conveyor belt is moving it, and then the cap is applied at some other part. Okay, so that is the conveyor belt. So the nasal mucosa, so this is what is the mucosal blanket. Okay, it moves backwards into the nasopharynx. Okay, like a conveyor belt. Okay, and all the small secretions, then they are taken into the nasopharynx, and from where it goes down into the stomach. It is swallowed. Okay, so look here. This is the gel layer, and this is the sole layer. Okay, and in the sole layer there is cilia. So now you may have a question like, why does it move back? Okay, like why isn't there stasis? Okay, so the answer is, okay, the cilia, it beats backwards. That is why it is taken back. But then again, you can ask, like, if it beats backward, then it also has to recoil. It comes forward. So in that way, so this part, the gel layer, which with the trap particles, okay, this should stay at the same place. This should not be going to the nasopharynx, but it doesn't happen like that. Okay, the action of cilia is not same. Okay, so the back phase is very fast and the recoil is slower. Okay, I must have a diagram there. Okay, look here. This is a mucociliary blanket. Okay, this is a mucous layer, and this is the serous layer, and the cilia, they are here. Okay, then there are two strokes. Okay, this is the gel layer, and this is the sole layer. Okay, this is present in the sole layer. So this is the active phase. The active phase is very fast. Okay, and it reaches up to the gel layer so that it is moved back. But the recovery stroke is like this. Okay, so the upper part is unaffected. Okay, so it recoils like this, and then when it beats backward, it goes like this. Okay, and thus this trapped area, the area with the trapped particles, it is moved down, and thus the lungs, they are protected. Factors decreasing mucociliary function. Okay, dry atmosphere. Okay, in absence of humidity, similarly smoking, air pollutants, and nasal irritants. Okay, they decrease mucociliary function. Okay, infection. Okay, we have already covered the anatomy part, right? But because look, we are already in August, right? Now, Shravan end bhayo. I'm a class, right? It won't be running later than Osos bitra sabai kuro bhyaunu parcha hola. And till now we have not even completed 50%. So this class is long because two classes have been combined together. Okay, the anatomy and physiology. Actually, this is for. Okay, actually, like this is meant for two classes. Okay, we are going fast. Okay, so the dry atmosphere, infection, extremes of temperature, hypoxia, and there are several drugs. Okay, that decrease mucociliary function. I think okay, this is definitely overwhelming for you because you are fed with so much of information, right? But even if you remember the important topics, I know, so it will be easier for you to prepare for exams, right? You know that I know what you need to know, I know what you need not know. तपाईले देख्नु भयो ए कता गयो okay, now look here. Okay, these are the paranasal sinuses, frontal sinus, modal sinuses. Okay, and because of the blockage here, okay, and look, this is the this is okay. Look here, the normal cilia beat back and forth, propelling mucus and trap particles out of the sinuses. Now the cilia can become paralyzed during acute sinusitis. Sinuses are congested with mucus, and chronic sinuses for the damaged cilia, the mucous line becomes thick and scarred. So the normal cilia is here and here. So this is what happens after chronic sinusitis, and the cilia become damaged, and there is further deterioration of the disease. Okay, the ventilation of the PNS. So in inspiration, negative pressure created in nasal cavity sucks air out of the paranasal sinuses via their ostium. And during expiration, eddies within nasal cavity create positive pressure, ventilates the paranasal sinuses. Now let us go back to this slide. Okay, here. So during inspiration, okay, there is a negative pressure, okay, and because of that, all the air from the paranasal sinus they are sucked in, okay, and they go out. And during expiration, because of the determinants, there is not lamellar flow, okay, and during this phase, the paranasal sinuses they get ventilated, okay. Now this is what happens, okay. During inspiration, the air is sucked, and during the paranasal sinus, there is positive pressure, and the paranasal sinus they are ventilated. Okay, this is the same slide that we had reviewed earlier. Okay, so the drainage of the paranasal sinuses. Okay, so here in the inferior meatus, okay, only the nasolacrimal duct, and most of the openings are here: the frontal sinus, anterior ethmoidal air cells, and the maxillary sinus, and then the posterior ethmoid in the sphenoethmoidal recess, and the sphenoid sinus in superior meatus. Okay, so look here. Okay. Okay, there is another line, another white line. Okay, this is for the anterior group of ear cells and the posterior group of ear cells. Okay, now look here. This is how the mucociliary clearance occurs. Okay, but because there is a blockage here due to edema or due to various factors, there is the stasis of the secretion. So the fluid is collected in the sinus, and the mucosa they are thickened. Okay, and in the normal part, okay, it is being cleared like this. So the cilia, they propel the secretions towards the opening. Nasal resistance. Nasal resistance expired at this positive pressure in the respiratory tract and prevents alveolar collapse. Okay, nose provides 50 to 60% of total airway resistance. Nasal resistance is provided by three areas. Okay, nasal vestibule, nasal valve, and okay. So this is okay. Let us skip these things. Okay. So this is the nasal valve area. Okay, this is the nasal valve. This is where the pyrophytic pressure lies, and this helps to provide nasal resistance. Now, this is an important test that you need to know about, Cottle test. So, in patients who have DNS, suppose a patient has left-sided DNS, so it becomes difficult for him to breathe in through the left nose. And if you pull the muscles of the face like this, the patient is able to breathe properly. So, in this case, the Cottle test is positive. So, because because of the pulling mechanism, the nasal valve area is freed. Okay, there comes some space. Okay, so if the Cottle test is positive, so you need to know that there is some sort of obstruction in the nasal valve area, and it is mostly due to deviated nasal septum. Okay, so the nasal vestibule, the nasal valve, and the nasal terminals. Okay, they provide a resistance. Also, look, more call गर्छ है एकछिन म क्लासमा छ है अहिले ल and see here, okay, this is the amount of resistance provided. Okay, the vestibule provides a little resistance, and the terminals they do not provide much resistance, but most of the resistance is provided by the nasal valve area. Okay, let us vocal resonance. Okay, the nasal cavity and the paranasal sinus cavity provide vocal resonance for nasal consonant like the ma, na, and na. Okay, and denasal voice is seen in nose block, and these consonants are pronounced as like ma is pronounced ba, na is pronounced the, and like that. Okay, similar nasal reflexes. Okay, there is smell reflex, increased secretions of saliva and gastric juice, nasal pulmonary reflex, nasal stimulation by cause mucous reduction in breathing, example nasal packing, and sneeze reflex. It protects organs, foreign bodies. Okay, nasal cycle. Okay, so what this is important. Okay, so like you need to know about this. So nasal cycle is a normal mechanism. Okay, so it means there is a intermittent congestion and decongestion of the nasal cavities, and one nasal cycle lasts for about 2 to 4 hours. So it means that for a particular time, or say for 3 hours, the right side may be congested, and so during that time the left side is decongested. So this process recurs. So you are not aware of the nasal cycle. Okay, when you are aware of the nasal cycle, when you feel that okay, one of my sides is getting blocked and the other is good, through the other I'm able to breathe in normally. So it means that there is some disease. So it is a reflex periodic alteration in nasal airflow resistance between two nasal cavities. It is regulated by autonomic nervous system. Okay, and it's due to the congestion and decongestion of venous sinusoids. Okay, look here. So this is the congested side, and during the congested side, the activity decreases here, and the breathing activity decreases here. And during the congested time here, so there is decongestion here, and the most of the functions of the nose are taken care of by this side, and after some time this alters. So factors modifying nasal cycle: temperature and humidity of surrounding area, head position, body temperature, physical activity, okay, emotional and psychological status, and hypothyroidism, okay, and the use of nasal decongestant and antihypotensives. And here, this superiormost part is the olfactory area of the nose, okay, this is covered by the olfactory epithelium. Okay, so the olfactory dysfunction causes upper respiratory viral infection, idiopathic, okay, head trauma, and sinonasal diseases, neurologic psychiatric diseases, and intracranial neoplasms. Now classification, okay. Okay, just like hearing loss, it is classified into conductive loss and sensorineural hearing loss. Okay, conductive loss is by, okay, if there is some sort of mass in the nasal cavity or some inflammation, okay, due to which there is edema, and sensorineural loss is damage to the neuroepithelium. So there are different types of olfactory dysfunction. Okay, so we need to know the definitions. Okay, anosmia means absence of olfactory sensation. Hyposmia means decreased olfactory sensation. Okay, parosmia or cacosmia is perception of pleasant odor is an unpleasant odor. Phantosmia, okay, perception of odor in absence of olfactory stimulus. Okay, hyperosmia, increased olfactory sensation, and olfactory agnosia, inability to identify odor. Okay, so these are not difficult. Anosmia, hyposmia, okay, phantosmia. So this phantosmia comes from the comic character of phantom. Okay, so phantom was an invisible or a character that did not exist. Okay, so you must have okay already been taught in orthopedic. Okay, there is something called the phantom limb. Okay, there is no limb in amputated patient, but the patient feels that there is the limb, so that is called phantom limb. So similarly, phantosmia. Okay, so there is no odor, but the patient feels that there is some sort of smell or the odor. Okay, there are various tests for olfactory disorders. Okay, so one of the tests is rhinomanometry, and similarly the ciliary function test. Okay, we are not going to go into detail in the rhinomanometry. Okay, this is the machine, and the saccharine test. The saccharine test, it evaluates ciliary function by measuring the time taken for a drop of saccharine to be tested in throat when applied to inferior turbinate. Okay, so a drop of saccharine is put on the inferior turbinate, and because it moves backward, the cilia should be beating properly. So after some time, if it is tested in the mouth, it means the ciliary function is normal. Okay, and then there are different olfactory function tests. Okay, so these are there are many cards like this, and the patient is asked to smell, and then he is asked to scratch here, and then there are different sides, different methods. Okay, and the patient is given on a some box with on a identify smell, and then he's asked to tick here on the charts. Okay, this is a manual threshold olfactometry, and this is a dynamic threshold olfactometry. Okay, so when will hyposmia or anosmia occur? Okay, nasal block. So if it occurs due to nasal blockage, then treat the disease. If there is upper respiratory tract infection, then the medical treatment is given. So it can occur in old age. So there's little that you can do in old age. So you need to counsel the patient. So if it is due to head trauma, so neurosurgical reflux is important. and it's obvious smoking will cause hyposmia, so quit smoking. And if it is due to toxin exposure, then avoid exposure. And if it is due to congenital cause, then endocrine referral. And if there is parasmia with seizures, then neurology referral. And if it is if there are psychiatric symptoms, then psychiatry referral. Counseling of the following: spoiled food. Okay, so one of the most the smell function is not only for the good smell, it is also protective mechanism. Okay, so suppose the patient he has anosmia, he can't smell anything. Okay, and even we have hyposmia when we are suffering from sinusitis, we are not able to smell anything properly, so we cannot know if the food is good or if it has been spoiled. And if you take spoiled food, then you will get ill, sick. And similarly, if there is a gas leak, the patient with hyposmia, okay, they cannot smell, okay. And if they just light the gas stove, then there can be a big fire, okay, which can become fatal. So such patients should be asked to use the electric stoves or the induction heaters. And as such patient with hyposmia or anosmia, they should use smoke or fire detectors with visual alarms. And similarly, socially unacceptable odors, they cannot be, smelled. Okay, so that was all for anatomy and